on remote. Status of remote, how is it going in? How is the testing going? All those things. And then, follow-on meetings will be like, how is it going? Have we resolved all the issues, whatever. But that means that some of these work sessions will push out, like the one from Tuesday night coming up will push to Thursday, and Thursday to Tuesday, and you get the idea. So anyway, with that, why don't we get started?
Okay, good evening, everybody. My name's Laura. I'm the proud superintendent of the Millbrook Central School District. Welcome to our Board of Education work session number 3. Tonight, we will be focusing on health and safety. We are using the New York State Education Department's reopening guidance and assurances to guide this work and our discussions. This evening, our panelists include our Board of Education, school nurses Maureen Sipe, Julie Zengin, and Raina Monahan, industrial hygienist John Evans, from the Dutchess County Department of Health, Andrew Evans, coordinator of communicable disease, Judith Rosenfeld, supervising public health nurse, assistant superintendents Caroline Hernandez Padala and Brian Freed. I see director of technology Elliot Garcia, director of facilities Mike Ragusa, and Tom Lipka, principal. There are 20 mandatory requirements that specifically fall under health and safety, and we will share and discuss each one. Please note, as we say at all of these sessions, we're sharing the best information that we have at this time to help prevent the transmission of this ever-changing coronavirus. We do not know what tomorrow will bring. Any unanswered questions will be answered and posted on our FAQ sheet. It's posted now on our homepage, and there's a link to all of the questions and answers as we're getting them throughout these parent meetings as well as board meetings. So let's talk health and safety. Brian, could you cue us up?
Sure. Cheryl, can you just allow me to share?
Yeah.
Thank you.
Got it?
Still saying I can't.
Got it now?
Let's say the third time will be a charm.
Okay. Got it?
I do. Thank you.
Okay, you're welcome.
Good evening, everybody. Is it everybody able to see the presentation?
Yep.
Yes.
Great.
Yes.
Okay. So yes, today is health and safety, and it's our third work session. And the health and safety that we'll review today is pages 17 through 46 in the 145-page SED guidance document. So each reopening plan must review and consider the number of students and staff allowed to return in person, and the factors that need to be considered when determining the resumption of in-person instruction are the following: ability to maintain appropriate social distancing or face coverings, PPE and face covering availability of safe transportation, and local hospital capacity. And we're to contact our local Department of Health. So Mike, would you like to kick off? And some of this may be repetitive for what we've covered in the past. Mike, would you like to kick off and talk about what we've done in terms of social distancing, labeling, and PPE and face coverings?
Okay, so what we did in all the buildings is we put 2 yellow lines down the hallways with one-way arrows going each way, so everybody stays in order and going the same way, so nobody's like intermingling. At the intersections, there's one-way arrows on the floor. Wherever there's could be a line for a water fountain, a bathroom, and we added on the way out of the building to catch the bus, we added some lines every 7 feet apart. This way, if there was a backlog on a bad day or something, the kids would know where to stay. So as far as social distancing, we should be in pretty good shape. And then as far as face masks, face covering, we have plenty of masks, adult and pediatric. There'll be bags of 25 masks on each bus, and as they need it, we'll give them more. And then we'll have masks, I'm sorry, at each entrance in plastic bag, in case anybody comes without one. Was that me? Thank you.
No, it's me, John Rudy.
I told you can't play Jimi Hendrix on these meetings.
That's where, so each bus will have a bag of masks. Each entrance will have a bag of masks, and I mean, everybody should have one, but if they don't, we'll have them right on hand to hand them to them. Okay?
Great. Thank you. So in terms of availability of safe transportation, we've been working with First Student all throughout, and they've been working very hard, paying attention to all of the requirements. Laura and I had and Mike joined us as well, had the ability to visit them yesterday and look at what they were thinking about with how students are going to be separated, and what they're doing is on each of the buses, because while most buses are standard, there's a little bit of a difference. They're going on to each individual bus and customizing seating for the number of children who are going to be on that bus, and deciding exactly where students are going to sit to maximize social distancing. Of course, all students will have masks on the bus unless they're medically unable. So our availability of safe transportation is well intact. And now in terms of our local hospital capacity, I don't know if anybody from the Department of Health would like to speak to that, but certainly the school district will be contacted if there are any implications for that. Anything, Judith or Andrew, that there is to say about that, or are we good to go?
I gotta unmute myself, sorry. So yeah, I think you're good to go, unless Judy has anything to add. So.
Oh, actually, the numbers are very low right now in the hospital. So no, I think at this time you're okay.
Great, thank you. So each reopening plan has a written protocol for actions to be taken if there's a confirmed case of COVID-19 in the school, and that is true for us, and that is in our reopening plan. And in fact, here locally, we have a version of a flow chart about what to do, and if there is a confirmed case, we're right on the horn with the Department of Health, working hand in hand with them in any case.
So does the health department provide us sort of the process of, it's not a confirmed case of COVID, but kid got sick on a bus, whatever, do we get a set of protocols for those situations, or is that something we're looking to our district medical team?
I'll speak somewhat to that. That's been always the rub with all of this. It's easy when it's somebody that we know is positive. When somebody has symptoms that could be COVID, that person should be isolated away and sent home as soon as possible. But it doesn't mean you close everything down or anything like that. You basically get yourself prepared, and then you either verify through the doctor that this person has COVID, or the symptoms are related to something about this person that they are, you rule it out in the meantime. But we are aware that there, especially as the fall arrives and respiratory illnesses start to go up, that this will be we're gonna have a lot of red herrings out there. So you just gotta use your best judgment and best caution. The other thing is, like Dr. Julio always says on the superintendent's calls, that these are mitigations and nothing is 100%. You're going to try your best to contain it as well as you can. And we will help guide you when that situation arises. Do you have anything to add, Judy?
No, actually, I was going to say that if they have a child that's symptomatic, just to isolate that child, quarantine the child at home, and rule out COVID. And then, of course, if the child did test positive, then we would be involved. Yeah.
Yeah, I was,
Have is, so we have a lot of resources out there. This was provided, I don't know if you could, how well you can see it, but this was provided by the by Dutchess County. Each of our school buildings has one of these flow charts to think about how we should be treating individuals based on what they're presenting. So that's very helpful.
but
So if someone is sent home, do we require a test? Do we require a doctor's note, whether that be staff or student, in order to come back to the school?
So I'll speak to that. In the New York State Department of Health guidelines, they actually specify all of those things. They want the child cleared by a provider. They would like the child to be tested, and they want the child have resumption of symptoms, all of those things.
Do we have any requirements as a school district as far as when a child can come back, or what's, because, I mean, they suggest they want, but it's not required. So are we going to require anything as far as a note from a doctor at the very least, or are we going to require a test? I'm only asking because the test can take, you know, anywhere from 4 to 12 days, depending on the time.
Yes.
So
yeah, so I mean, and I guess this goes back to our question about, you know, repercussions. Is where is this stuff defined now, so that, you know, what Chris was describing, you know, we have a process in place that says, yep, without a doubt, you got to get a test. It's got to come back negative before you can re-enter school, so that there's no interpretation. I mean, one of the things that I'm sort of assuming we're doing or going to do is test our procedures. You know, hey, kid just got sick, you know, threw up in the classroom. What do we do? How do we move the kid? Where are the kids? You know, does the teacher move them? Does the nurse move them to another area? You know, what do we do with that kid down the hallway? You know, almost like fire drills, but COVID drills, because you don't want to end up with this, you know, it'd be nice if they did this, it'd be nice if they did that. You know, we want to make sure we've defined like basically every process.
So what we require in our reopening plan for a student to return to school after illness is documentation from a health care provider following that initial evaluation. We require a negative COVID-19 diagnostic testing result, and then what we're calling symptom resolution, or if there's a positive test, there needs to be a release from isolation. So all of those things here in Millbrook will be in place before a child is able to return.
We've also spoken about with the school nurses, a call ahead, that we don't want students just sent down to the nurse, so that we can be very specific about not sending them to the well office if they really need to be sent to the isolation room. If they are symptomatic, they should be going to the isolation room. So we had a meeting with the nurses and we've discussed all of this, so that when we are having those meetings, when we're educating the staff specifically as to what we are doing with students who are symptomatic, first of all, not only what are the signs and symptoms of COVID, but also what do we do if a student is presenting with those signs or symptoms. We want to be very specific in where we're sending those students, how they're getting from the classroom or from the location in the building to that particular area, because we don't want to be sending students who are symptomatic into the well room with the nurse. So we want to have communication prior to sending students down with the nurse, so that they can be very specific as to where that student should be sent and how they are getting from their location to that location where the nurse will then see them.
So Caroline, is that flow owned by the nurses?
Yes.
They'll have to figure it out, I guess.
Right, so the nurses are going to be directing the staff as to where those students should be based on whatever they're being told, because the nurses are the ones who are going to understand the symptoms that they're being told in the moment, to be able to direct the staff that that student needs to go to the, you know, isolation room.
I mean, honestly, you know, it's sort of a half-hearted comment, but I really think we need to have, once they put these in place, have drills that run people through them so that when it happens, it's just second nature, like a fire drill. Nobody really has to sit and think about what to do, or active shooter. No one has to sit and think about what to do. It's just, we've done it 100 times. Now we're doing it. Well, I mean, I'm thinking this needs the same kind of plan, is running through, getting the teachers, getting them through the process, testing them to see, if they truly understand it. I mean, it's because it's such a bizarre set of circumstances. I mean, it could be a kid puts his face in that thermometer and it goes red. What do we do? I mean, and suppose the nurse is already in the quarantine room with somebody who does it. Because that's going to be one of my questions later on to the nursing staff is, are we prepared, personnel wise? But
Right. And so the one way in which this differs from the safety plans that we do have for other circumstances is we drill for those things for automaticity, and for anyone to have and be able to, in any circumstance, be able to execute one of those responses. The one thing that we don't want is we don't want to miscue where we have a teacher or a staff member sending a student to a location, be it the nurse's office that students are used to going to, and they think they're just going to see the nurse. So they, out of habit, walk to the nurse's office when really they should be going to the isolation room. And we have that kind of miscue that can be putting people in danger. So while we do want everyone well informed, we don't want that level of automaticity where people operate out of habit and therefore it causes a miscue. So yes, we need people well informed, but we need to make sure that along the way we don't lose that purposeful communication that we're trying to build in, and that's why we want that call ahead.
well, it seems like you've got, and I mean, there's a perfect example. The process should be do a call ahead first, and then run through a couple examples. But I guess once these things are more carved in stone on what to do when, including all the way to the buses, I think it'll be much easier to, either like I said, test it, or at least have some sort of, verification document that, they've been through the training, they understand it, they've been able to repeat, sort of, I don't know. But anyway, sorry.
John Evans, I see your hand up. Did you have something that you wanted to add?
I'm not hearing in the return to school after a presumptive positive test. Everybody keeps throwing around this word, they need to have a negative test. The term test needs to be defined by the district. The term test right now, it seems to me, could be anything. Do they have a negative test for antibodies that anybody can go get at CVS? Or do we have to get a different, like a specific type of test that is approved by your healthcare staff or maybe approved by the board? I don't want there to be a wide array of choices for students to be like, oh, I went and got the 99-cent test at the dollar store for COVID, because that's coming, believe it or not. So we need to be very specific about what you mean when you say negative test.
I was wondering, can Andrew or Judith speak to that? Because I know there's the 15-minute test, and that could be a negative is a negative, but a positive may not necessarily be a positive or a negative.
Yeah, I'll let Judy come in after. From what my understanding is, yes, when you have a rapid, that's called a rapid test. And when that's positive, it should be verified. But from the way we go about things, if the rapid test is positive, we will act like it's COVID until we know it's not COVID. So I think that's the way to go. There's just so many testing modalities out there, what you guys choose to do with that or not, and whether, whether people have insurance, the ability to get this test, that kind of thing. You have so many moving parts to this. So it's just, what you guys decide, but if you do it through a doctor, that's probably the best way to go if you can. Judy, do you have any thoughts?
Laura, was there any follow-up with Dutchess County, how they were going to assist with testing, additional nursing, all of that from Molinaro? There was a press release that was out. So I didn't know how that affected as far as how they're going to assist the schools in testing.
I don't have that information fully, but I can look into it. Do you mean about the insurance for people?
You talking to me or are you talking
Yes,
to?
Chris. Did you mean about the insurance availability and support?
Well, just across the board. I mean, if they're going to allow, right now, like I said before, it could be anywhere from 4 to 12 days to get a test. So,
Yeah.
If they're going to allot a certain amount of rapid tests in Dutchess County for school systems, I was just wondering what kind of support they're actually going to give. And if it's support meaning monetarily where it's going to be covered, or support meaning the test will be available, I wasn't sure. So
I'll look into that more.
So just to confirm, the kid gets positive COVID test. They're out until, well, even I guess COVID symptoms. They're out until they can get a test, get rid of the symptoms. They have a negative test, and what was the other thing? But there was one other thing, and then they can come back to school.
Yeah, there's documentation from the healthcare provider following the evaluation, a negative diagnostic result from a COVID-19 test, and released from actual isolation.
So Elliot, is it a problem, like if a kid is taken out for COVID symptoms, how long would it take? I guess assuming they have a book at home, Chromebook. Assuming they've got one already, because we're 1-to-1. How long will it take to get them switched over from, the being in school? I'm assuming that's what we would want to do, unless the kid is really sick. Then of course, no. But if the kid is not that sick and wants to stay with the material, how quickly could we get that person moved from in school to to being even down to the attendance that they're still in, but they're not in?
Well, I think it'll be rather instantaneous because, as far as I know, and we'll have to work through this with our instructional staff, but we're going to assume for the most part that our teachers are going to be operating through a Google Classroom blended instructional environment anyway, because we're going to have at least some students that are unable to attend live instruction regardless of our mode at the time. So assuming that the Google Classroom or online platforms are active and running for at least some of our student population, the student would be able to put their Chromebook in their bag, go home, log back in, and continue learning, as a remote learner.
But we don't want, and maybe we do. I haven't heard this yet, but we don't want our students sort of like when you're in college, I'm not going into class today, right? We don't want them just going back and forth. I didn't feel like doing hybrid this week, so I'm going to do remote. My parents are going to Florida, so I'm just going to go remote for Thanksgiving week. We don't want people willy-nilly jumping back and forth. Part of the idea is to balance this, and to they're in school for a reason. So do we have some sort of control on them? Like, no, you can't just stay home. Without calling in sick or something.
Right, but that's the medically unable piece that he was talking about. There will be some students who will be remote because they're medically unable to come to school based on their high risk, being in a high risk category, that they may be deemed medically unable to come to school at this point.
Right.
So they may remain in a remote category even if we return to school.
No. That's, yeah, my thing is, Caroline, more of if a kid gets, if a kid gets sick, like really sick, they're going to be out for 2 or 3 days, but I don't know, they got chicken pox and they can suffer through it to do their lessons. We want to have a way of flipping them on, but we don't want kids just, I don't feel like going to school today, or we're in Florida, so I'll log on from there. I mean, there's got to be some, because we can't expect our teachers to go, well, I don't see him in the room. Do I see him online? Trying to figure out who is where. I'm assuming there's only a certain number of seats that we can have during the day. We don't want people sort of jumping in and out of the classrooms.
Well, I think the question is two-part, if I'm understanding it, is are we able to, and then what's the process to? And the short answer is the technology and the infrastructure will exist for almost immediate transition, only because we're going to have those medically unable to attend students, as Caroline noted. So the second part of that becomes the process and procedural piece, which we'll have to coach our teachers and our building principals through as that transition to hybrid evolves. What's the expectation? What's going to be communicated to families in terms of expected attendance and their need to communicate the need to stay home to us and set up a procedure accordingly.
So who owns, is that you, Caroline? Do you own that, or is that Elliot, you putting that whole process together?
I think it depends on which part of the piece. The expectations for attending school is sort of mine and sort of the building principals, and then the expectations for technology and where attendance is required to school, right? Because if there is no medically necessary reason for a child to be home between the ages of 6 and 16, they are to be in school.
Yeah, and I see us working together on that to develop that document, the procedural document that we'll share out so that it's clear to everybody as we're preparing to make that transition.
So how are some districts just basically saying you can make the choice to stay home, or you can make the choice to go in? Dover asked their parents, from what I understand, to choose, and their choice has to stay in place till January. How do they do that? Because why would we not, if there's kids that are, just scared to come back, or for whatever, why would we not let them continue on remotely?
Yeah, I don't want to speak about the specifics of another district, but it could have something to do with the inability to social distance their full population or something to that effect. So I don't know if Laura or Brian has more specifics about any other school district, but it could be factors that we don't necessarily have, here. So I don't want to speak specifically about another school district.
Yeah, and I think it varies. Just to Caroline's point, it could be about resources, personnel, space, budget.
But was that when you said if they're physically able and 6 to 16, they have to be in school? Were you quoting a law, or was that just sort of the Millbrook rule?
No, compulsory education.
Yeah, so I'm wondering how Dover can basically say, you just choose whether, that's all you need to do.
Not in school, but be educated.
Right. So it doesn't mean in school, right?
Right. It means attending school hybrid, in-person, remote. Yeah.
So, I mean, if some of our parents decide that they want their kids staying in, but they're not going to send them to school, they'll send them to virtual school. I'm assuming that's okay. Then getting back to my point was, once they've made these choices, we don't want them, flipping out and then flipping back. And, one day our capacity is fine, and the next day, it's out. And then, if we have a snow day, forget snow days. We can all just stay home and learn from home.
Most school districts are requiring that it's a commitment for a quarter, that if you are going to remain remote, you are remaining remote for a quarter, like a marking period. However, if you are committing to being part of the hybrid group that's coming in, you're committing to that for a period of time. But if you decide that you need to go remote for whatever reason, that is a switch that you can make. But then you are committing to being remote for the remainder of that marking period. Okay. I think one of our school nurses, Maureen, is trying to say something.
So my name says Julie because she gratefully shared the email because somehow it missed me. My name is Maureen Sipe, and I'm a registered nurse working in the district. I just wanted to comment on just the in-school, out-of-school piece and that fluidity. And if, administration, if I'm not on exactly your page, by all means, jump right in. But my understanding is that fluidity in and out of school is actually almost the gift in this time. And the fact that you have the technology at Millbrook to, as Elliot said, move relatively quickly back and forth, that I see that as one of the highlights, to be truthful, because the threshold of being in school by way of health is very low. So because the symptoms of COVID could be simply masked by so many other, the common cold, some allergies, things like strep throat could give you a fever. Any of those symptoms are going to put the student out of school. If they are well enough to engage in school activity, even though they're homesick, the school work is still there for them, right? And the instruction is still there for them. So I think, just as I was listening, being in a school nurse position, I anticipate absence rates will go up, but absence rates from physically being in school, as opposed to, I feel like there's 3 levels of attendance now. You're in school, you're remote school, and then you're not participating at all. So those first 2, being in school or being learning remotely, those are going to be somewhat fluid, because unfortunately, if a student has a sore throat, even if they have strep throat, they're asked to go out and seek medical attention, right? So then once they're out, they may have to stay out until their COVID test comes back negative. So they may have 3 days out of school for their sore throat, which may not have been the case in years prior. But now a sore throat, symptomatic sore throat, is going to have you out for 3, 4, maybe 5 days, potentially, until you get a negative PCR for COVID. But you don't have to lose 5 instructional days. Yeah. And then they can come back in once they're cleared to come in. And if unfortunately they have a direct exposure to COVID and they must quarantine, they're out for 14 days, but they have the opportunity to learn remotely for 14 days. When even if you have a positive student, they could be asymptomatic. Henceforth, they could be learning from home, but not physically be present in the building.
Well, I think that even if you shut a classroom, because there's, I don't know what the, specific numbers are, but you're right. The ability to move from there to, whatever the class is, to move that remotely, and then, at the end of the, whatever it is, be able to bring them back, or, some of them stay home, whatever they want to do. My only worry is just, people flip-flopping back and forth, and then it makes a mess of the attendance, trying to take attendance because you think the person's in school and they're from home and this.
So I absolutely recognize your concern with that, but I think there's more documentation required. So you can't just be like, I felt sick, I stayed home today, I felt better, I came to school today. Because if you were symptomatic and stayed home, you're requiring significant documentation to come back to school. So I think that's something that we'll make sure is clear in the presentation to students and family. It's not, Susie was super tired, so she stayed home from school today. But if fatigue is a symptom of COVID, and that would require medical attention. If you stay home because you're symptomatic, you are requiring medical documentation to return to the school building.
So are the nurses going to take on the responsibility of, Sally called in, Sally's mother called in, said she wasn't feeling well. Are the nurses going for that? I mean, the first call in would probably be, is she running a fever? Does she have a cough? But are the nurses then gonna take the responsibility of reviewing, like, every kid, well, this kid had a stomach bug. Is that is that
Yep.
symptomatic, or, and if it is, so any kid that stays home at any time is going to end up needing a COVID test to get back into class?
I mean, short of a sprained ankle or something that is, no, I'm not being facetious.
No,
I
I
mean,
was going to say, sure, that's not a COVID thing.
no, a physical trauma, something like that, God forbid, a head injury that's, different, a different pathway to return to school. But unfortunately, the symptoms of COVID are synonymous with so many other common illnesses that there's going to be a lot of crossover. And again, that's why I would view the ability of Millbrook to be fluid back and forth as an advantage.
So this is a Millbrook, I'll call it policy. Unless they're out for a orthopedic reason or I don't know what else, to have their appendix out, surgery or something. Unless that's the case, they're out until they have a negative COVID test and are asymptomatic and all that other good stuff.
So yes and no. I mean, unfortunately, if they're going to a funeral or some sort of service like that, I would assume that would be accepted as an excuse for absence as well. But if they are out and the reason for which they are not in school is any of the symptoms on the list of COVID symptoms, then they need to have medical attention, seek medical attention or direction, and then they have to have the appropriate documentation to return to school.
And then what do you guys do with, I'm sorry to take this off, but I think this is one of the most important things we're going to talk about. So a kid goes home with a cold, or that's what they think it is. They
So
can't come back.
I don't mean to interrupt. Symptoms. Do they have a runny nose and a cough?
Yeah, they got a cough and a slight fever.
Okay.
So they can't come back to the test. They get a negative test. They're asymptomatic. Now, what happens to the rest of the kids that were in that classroom with the one that went home with the cold? Are they then tested? Are they sent home? What's the process that we've defined for that?
So I mean, I'm willing to answer, but if one of the people from the Department of Health might have, jump in. My understanding as of today is that the rest of the class, like the cohort they're in, the students that are in their classroom with them at the time that they had their symptoms, went to the nurse's office, to the isolation room, nurse had the parents come and pick them up. The students who were with them to that point stay exactly as is. If that student leaves the building, goes to the physician's office, has medical testing done, or in addition to a COVID test, they stay home until they have all of their results and are asymptomatic. If their COVID test comes back on day 3 or day 2, they're happening a little bit quicker now, and they were a positive case, now it affects their direct contacts. If they come back negative, there's question as to there are it's a whole cascade of flowcharts everywhere. They're quarantined, now they're negative. Is their cold over? Are their symptoms gone? Whatever. Now we can bring that student back into the classroom. All is well. Everyone stays in flow if their COVID was negative. If their COVID was positive, now next step is some tracing. So if we're talking about a student who is in a 2nd grade classroom, that 2nd grade classroom would need to go into quarantine because they had a direct contact with a positive case. Henceforth, transitioning online would be 2nd grade classroom with Mrs. Smith as teacher, and they don't miss a beat educationally, because that does not mean that all of those students are going to come back COVID positive as well. None of them might.
And the kids on the bus with that child, are they quarantined as well?
Didn't we start talking about the bus part before? The bus is a little less clear for me, to be perfectly honest. even the teacher, right? So the teacher's going out with them. Again, I do not claim to be the authority.
No,
If anyone wants to jump in, by all means. I think there has to be some like in-house contact tracing for the people, even maybe that student had gone to a special reading class with a different instructor, and that instructor had been in close contact, then maybe that teacher also goes out on the quarantine. But if they had less direct contact, you know, in a special or some other learning environment where they were distanced the whole time from another employee, then that employee does not end up needing to go on isolation. It's complicated, but there are sort of yes, no answers to everything.
This is Andrew from the health department about the bus thing. We've experienced this with the prisons, with guards transporting inmates in vans and buses. And the state health department considers all the people in the vehicle exposed, unless they're wearing full PPE and a N95. I know and that's the tentacles that this has. It's like I said, it's casting a wide net. I mean, you know, but again, you know, we could work that out unless you have assigned seating and know that the person was only within a certain circumference of certain people and somebody was watching them and that they didn't, you can't guarantee, unless you have eyes on them the whole time, you can't guarantee it. So when they're in a confined space with someone, you know, within 6 feet, 6 feet or less in the 10 to 15 minutes, that is the rule. But like, you know, when you start putting children in rooms and, you know, eyes aren't on them all the time, we can't guarantee what's happening. So I think you're just erring on the side of caution, because God forbid you didn't do that, and then there was a bunch of spread cases on that bus ride, and then potentially you get a lot of pushback from the parents or whatever.
So a kid tests positive, the class goes in quarantine, and the people on the bus go in quarantine, which could be multiple schools. And how far, and I probably should have read about contact tracing, but how far does it go? So
we go back, I can explain it in exacting detail.
Okay.
Patient X tests positive, okay? We would go back 2 days before. There's two things. If they had symptoms, we go back 2 days before their onset of symptoms. That is considered the exposure period. And then it's afterwards as well. Let's say they were in school a couple more days. It's within that time frame. That person, the kid who's positive, has to isolate, that's the term, for 10 days. And then on the last day, they have to be fever-free without a fever reducer. And you guys, that's our standard. But the contact tracing is related 2 days before the positive test or the onset of symptoms. That's our focus area. And so it would be, if they rode the bus on those 2 days, we would have to consider quarantining those people on the bus. Again, positives are far easier. I know it sounds horrible to say, but a positive is a far easier scenario. It's the fuzzy ones with symptomatic kids. And like we were talking before, when somebody's symptomatic, we don't shut everything down or send people home, because that's a contact to contact. Those exposed people are considered still incubating. So, you know, that kind of thing. So we have a little bit of time in the real world sense of things, you know, and hopefully, like somebody alluded to, it's not a 12-day test result, but it's a, you know, 2 to 4 day test result. So yeah, but if a positive person is found to be in the classroom and on the bus, if it's considered in a closed space, you know, the cloth mask or the surgical mask are not considered protective according to the guidance.
And just when I said how far, I was kind of, so this kids on the bus, so that takes the kids on the bus, but do you keep going, like the kids on the bus met with these kids in these classrooms?
No, that's the contact, that's the 2 degrees of separation, which we don't count, okay?
Yeah.
Can I ask really quickly to this point, maybe Laura, I'm assuming that something will get sent home to the parents, like outlining all of this, like if your kid, so that they all know the instruction on what happens in these kind of scenarios.
Yes, absolutely. We're working on parent communication, clear, and then it'll be ongoing as well. And also we're thinking about parent universities, having trainings for parents. There's a lot of layers of training that we need as professionals, and then we need to teach our children, but we also need to teach our parents so that whatever we're practicing here that we know are good practices, they can do that at home as well. So it's as simple as putting on a mask. Maureen was explaining today, teaching students how to take off their mask when they're going to have lunch and how it should be placed on the desk, what side should be up, what side should be down. So there are very small moves that we can teach our children and each other about keeping safe and healthy. And those are the pieces that we'll be sharing with parents, as well as making sure that our website is up to date and filled with resources and information for parents to go to, as well as using School Messenger for updates or new news or new practices. So we'll be putting together a plan, more of a plan.
And I think in that document, we need to make sure that the other side of it, little Johnny didn't wear his mask or refused to put on a mask. We need to be very clear with parents what's going to happen, because the last thing in the world you want, I would think as a parent, is to get a call, your son's out of school for 5 days because he refused to wear a mask for the second time. And you go, whoa, 5 days, no mask, what? We want to make I made that up. So don't get all crazy on me and start talking about the 5-day suspension. But whatever it is, we need to make that very clear, because we need parents to understand, this is not a matter of wearing your hat backwards or wearing your hat in the hallway. Wearing a mask is, grounds for whatever.
And also the very important piece of taking your child's temperature at home. We're requiring that. That's part of our partnership with parents, is making sure that you're sending your child healthy and ready for school. You're sending your child healthy to keep the other children healthy. So we have to lean on one another during this time. So giving your child an aspirin so the temperature goes down, and then we find out later, that's just putting everybody else at risk. So just being mindful of the risks that we're taking, and that we know we're busy and people have to go to work, but this is a big misstep if a child is sent knowingly with a temperature or some symptoms, that we need to be told. And we're here to help in any way we can.
I would like to say just really quickly, with the younger students who might be less comfortable with the masks on or used to having the masks on because, they haven't really been going in grocery stores, and, anyone who is doing the grocery shopping is probably the adult in the household. But just if, we can communicate to the families, like some conditioning, sort of like you want to watch your favorite show with the mask on the couch, and like just desensitizing the younger ones to wearing the masks for a longer period of time, So I think that there will be, over the remote period, there'll be some practice, maybe even some of our teachers will tell the class, all right, let's practice class with a mask on today. So that we can condition those younger students who have less experience wearing the masks to keep it on longer.
Hear me? Can I talk? Yeah. I would also just like to add that I do think that's important. That's a great communication with the families. But last week I was there and I was conducting the kindergarten screenings for 2 days, and I would just like to point out that all the kids, 45, I think, of our youngest learners, 4 5-year-old kids coming to the school for the first time, all came in wearing masks without an issue for the entire time, even in the most stressful, worrisome, anxious time. They were greeted from the teachers and staff. We were all wearing masks and gloves. And they were taken from their parents into the building, maybe for the first time. And there was not one issue regarding the masks for the whole time they were with us. So I think this was a great example of how resilient the kids really are, and how if we don't stress them out, they're not going to be stressed out about it. And I thought that it was really, really a great sign and really hopeful, you know?
Julie, this is Julie, it's Claudia. I have to 100% agree with you on that. I am out in the field every single day. I am in from doctor's offices to stores to grocery stores. The kids just know to put them on. They have them on. I don't see them ripping them off. I don't see any of that. There's no crying. There's no fighting. I mean, I've even seen the kids wearing them on the beach. You know,
Yeah.
I just think that if we don't make a big deal out of it, they're not going to make a big deal out of it. So just go as it is. I mean, my son has gone to Lourdes for orientation the last 2 days. They went to school with him on. It seemed to be fine. Was it a little irritating? Yes, but he says, Mom, we all did it. We had to do it. We were told what we had to do. We did it.
Right.
And that was
Right.
it. So
Right.
I 100% agree with you, Julie.
Yep.
Yeah, and we experienced that during summer school as well, that they came in, they knew they had to wear their masks, they were social distancing, they were sitting in their classrooms with their masks on, laughing and learning and engaging with their teachers. So I believe too that the majority, this is just our life now. This is what we do. And some will misstep, and we have a conversation and figure out what we can do to help that student with safe practices.
And actually, Mr. Sotero is listening in and did just comment that many of our students, even our little ones, are participating in summer league and may even be, you know, watching older siblings on summer league. And many of the leagues require that they wear masks at the parks and whatnot while watching. So many of them are getting used to it out there in the community. So yeah, I think it's great practice for those that aren't doing that for whatever reason, because maybe they aren't being exposed to different places where they're required to wear the masks. But I think that some are, and those that we've come in contact with, either through the screening process, summer school, certainly have, you know, handled it and managed it quite well. But I do think that during the remote period, especially as we approach the hybrid, the start of hybrid or the transition and phasing into hybrid, we probably do want to be a part of that, easing into it with all of our learners, really. But definitely the youngest students who maybe haven't had as much exposure to wearing masks for consistent periods of time.
I mean, I honestly, I think right now, you know, if we can get through all the sections of reentry and start to, you know, make sure that we're prepared for all those. But at the same time, you know, every minute we put into remote is going to pay back, because, you know, it's obvious. I mean, how many kids in a classroom get a stomach bug? If all those kids are, you know, basically out the door till they get a negative COVID test, now you're just going to have a lot of kids in and out of school. And then, God forbid, but, you know, it just takes a couple of people and the district goes back, or, you know, Andrew Cuomo hears enough about it and shuts the state down. And if we're ready for remote, like we know exactly how to move over there and how to, you know, and everybody's familiar with it, it'll pay dividends. So, and I think the time to work on these processes of what happens when, I think it can't be valued enough.
Yeah, we definitely have to be agile, be able to pivot, be flexible. We always talk about working on a continuum so that we're slowly moving into a hybrid of whatever that looks like, into bringing more and more in, or less and less. So we're going to be reacting to the circumstances, situations of the coronavirus. And so we have to be exactly what you're saying, Perry, very flexible and thinking about being able to move in and out at any moment.
Has anybody, and I don't even honestly, I mean, I know that it's a number thing that triggers it, but if one of our staff or one of our, you know, teachers or even children, you know, if they go to Pennsylvania for the weekend and magically Pennsylvania changes from a no quarantine to a quarantine state, because I mean, It's happened to me like 3 times. What happened? Is that person now not allowed to work for 14 or 10 days? Or do they teach remotely for those 10 days? Or if it's an admin or a maintenance person, what do we do with, because that list is really dynamic. I mean, when we went down for a week and we were on the list and off the list 4 times in the week. So what do we do with that with people? I mean, you can't shut somebody out for 14 days. So what do we do with that?
So I can answer the teacher part of it. The teachers were actually just last week put on the essential list. So that means, I see somebody nodding their head. Yes, so that means that they can work. They come to work, they wear a mask, they work the day, and then they go home and they quarantine at home. They can't go to the store, they can't go shopping, but for the time that they're working, they can work.
So so the teachers and everybody, they can basically sort of ignore that the quarantine states. I mean, they have to stay at home once they get there, but they can come into our schools and,
According to the recent guidelines, yes. Now, if the district decided that they can do a different plan and have that person quarantine at home, they can do that. But they just released it last week that teachers are essential.
Okay.
And they're also monitoring their health. They're just making sure that
Yes,
they're
they do. They screen, they're supposed to take their temperature twice a day, once in the morning and once at night, and monitor for any symptoms. And again, it's just for the purpose of coming to work.
And do we have to
I have a quick question, just in regards to the travel advisory. If I understand teachers are essential workers, which I had kind of heard that come through. I didn't know, maybe you could clarify where that goes by way of staff. Is it school workers or is it teachers?
It actually just says teachers. It doesn't specify staff, custodian, any other position, just says teachers.
So here's my next question. If you are a non-teacher,
yes,
and you go to an area on the travel advisory and you return, the expectation is that you would be quarantined in your home, as you just described, for 14 days, correct?
Yes.
Where does the negative, is it 14 days or a negative PCR, or is it 14?
Actually, yes. They can get tested within a very short period of time of arriving back into New York State. And if they are negative, they can return to work. Yes.
Excellent. Do you know what the time frame is? That, like, is it day 3? Or day 5 they can be tested, or?
I think it's within 24 hours of returning to New York State. Andy, did you hear differently?
It's within 24 hours of returning to New York State. However, what you're talking about is the time it takes to convert.
The incubation period?
Zero convert.
Yeah.
And so but I think that, again, I think they're just giving broad guidelines so that you can have some kind of plan to follow. None of it is perfect, like I said.
Of course.
And that's the thing to keep in mind. You're going to have a lot of what if scenarios, but you can't. So you need some, some arena to play in, kind of thing. But understand that not all of it is going to be precise. But again, I do want to say you can't ignore the fact that you went to another state. That's the key thing. And because we're getting a lot of, even from private citizens, not in schools, that they think that they're considered essential. So that means that they can go to work, but then they can do all those other things. As Judy said, they only go to work and then they go home. It doesn't mean they're free because they're essential workers.
So I just want to ask one more question on the travel advisory for clarification. If a student goes to a state on the travel advisory list. Then there's a honesty policy that student would then be quarantining for, quarantining for 14 days and or getting a negative COVID test in order to return to school. Is that a fair understanding?
That's correct, yes.
Okay.
Now, here's something that comes up often is I've had people ask me if the parent travels to a state that's on the quarantine list. The child does not travel with the parent. Does the child need to quarantine? And the answer is no. The
Okay.
child can come to school.
Interesting.
Now, if the parent travels, comes home and quarantines, and is in quarantines in a shared space with the student, parent comes back positive, student goes out.
Yep.
Yes, that's correct. Yeah.
And do we need to provide any special, or I guess this isn't required, but should we provide, if anybody is in that essential worker category, that we actually have to come, in, like, let's say a teacher goes to another state, gets put on the list, comes back. Do you guys recommend that, we give them face shields or gowns or anything specific to reduce that risk, or we just take a shot at it? As for the health.
I don't know that a face shield would really help or a gown would help. I don't really think that would do much of anything. Just as long as they're self-monitoring, checking their temperature, and wearing a mask. That's it.
Should they be wearing gloves or,
No, that wouldn't help either.
Okay.
The district could require them to take a test when they return within 24 hours, correct?
Yes.
Okay.
Yes, you could.
Yeah, that would be up to you guys, but how you want to go about that. They give you the guidance, how you enforce it, or if you want to take it further, that's up to you.
So, I mean, that's one of the things that we have to get, I would assume, documented. So God forbid we have one person come back from a state and we go, yeah, it's cool. And then the next one comes back and we say, nah, not until you, and, next thing you know, we're in trouble because we're treating people differently. So, I mean, I think getting as many of those drawn out of the heads of our nurses, the scenarios that might take place, and then what we do about it. Okay, cool.
Okay, so a lot of rich discussion there. On to the next assurance that we've made. Each reopening plan has a written protocol that complies with the Department of Health and the CDC guidance for the return to school of students and staff following a positive screen of COVID symptoms, illness, or diagnosis of confirmed cases of COVID, or following quarantine due to contact with a confirmed case of COVID-19. And of course, we'll be coordinating with the local health department. I think we've covered this a lot. I don't know if there's any other discussion or questions about this.
Just one, and it's sort of more a question for the health department than it is about the, COVID. So if I'm assuming when we write up our guidelines, this is what you do if, this is what you do when, once we get those done, I'm assuming we have to have legal look at them to make sure that, we're not violating anything. But does the Department of Health have the resources to basically review our specific policy or our implementation policies and provide us with, if you did this or you made this 48 hours versus 28 or 24 hours? Does the Department of Health have that kind of resource available to us?
I'm gonna just defer that to Mark, to have Laura talk to Marcus Molinaro about whether we have the capacity for that. Okay. I don't mean to like punt it forward, but just to make sure that, because that was not my understanding in the beginning. Laura, can you say differently about that, or? We were just to help you with the writing part of it, in case you had questions while you were writing it.
Right. And we did have legal look over our reentry plan, and it's in line with CDC and Department of Health guidelines. And then we really depend on each other for all of the nuances. It's sort of like we were talking earlier about the building safety plans and the district safety plans. They're pretty straightforward, but there are a lot of different kinds of scenarios that will happen. So we'll be prepared, but the story is going to be ever changing. And so that's when we have to partner with one another to see what are the best reactions or best processes that we should be using. But I feel that the Dutchess County Department of Health, they've been very responsive to our questions, because we have so many questions. This is not our wheelhouse. Our wheelhouse is education, or it's child nutrition, or it's facilities. So you've been so great, such a great resource with really good information, and just always that the information is changing all the time. So today's today, tomorrow's different. And I think one of your colleagues said it's clear as mud, right? So that's the world we're living in. But it was not my understanding that we would create these guidelines and then the Department of Health or CDC would read them over and approve them. They may give some guidance or some suggestions.
Yeah, that's what I was actually, I mean, having approval is interesting for probably a legal reason, but having their expertise applied to, geez, if you're, if somebody gets sick on the bus the way you have it right now, but if you did this, you wouldn't have those, somebody that can sort of, apply some additional, not just medical expertise to it, but call it outbreak handling to it. So when do we think we'll have like a lot of this stuff on paper? Because I mean, I know legal, I would assume we want legal to look like, if we had gone forward and say everybody that comes back 14 days comes back from one of these states has to stay out for 14 days. And then it turns out, that legal or someone like these guys tonight said, no, you can't do that, or don't do that, because teachers are essential workers. We want to make sure that, if we're saying we're suspending someone from school for 4 days because of X, is that can we legitimately do that? So when do you think we'll have this, this kind of documentation ready for, evaluation, or ready for advice? And then hopefully Mark Molinaro would have, it authorizes us to utilize more of your resource.
I think it'll happen over time, but it's really using our reentry plan and growing it out. So focusing on safety and health, and through these conversations, you could just see Maureen asking questions to fill in her own procedures to help us build out our procedures. So it's a matter of sitting down going, these are the things we need to think about that fit our community, our buildings, and what's doable, who do we need, what are the resources? And then there'll always be, again, that partnership with Department of Health, because there are so many different kinds of stories and things that can happen. It could even be on a bus. Did the student get sick in the back of the bus or the front of the bus? What were the kids around? Were they wearing masks? There's just so many, just one small happening or occurrence could have many different kinds of reactions. And so I think it's just sort of making sure that we're keeping up on the newest and the most updated information. Just like Judith said, now we have our teachers are essential workers. That's new news. So now we have to react to that and update maybe some of our policies and procedures. So it's building them out and then revisiting them all the time, because information is coming at us all the time, morning, noon, and night. See, Andrew.
Laura, I can understand that's a good answer. That's reality, I understand, but you've got to work backwards if we're going to open for hybrid. We do have to have some sort of steps, gauges when things have to be done by. We can't be doing it the night before, of course. So.
Right, of course.
Yeah, I mean, even if we had a date, let's say October 15th, we won't be able to tell you if someone got sick in the back of the bus or someone got sick in the front of the bus, what the difference would be. But if someone gets sick in an area, like it's a classroom, it's a bus, it's a gymnasium, what do you do? And you know, who do you call, and how do you engage? You know, who are the right people to engage in the district to start the contact tracing or whatever has to be done. And if we can get a set of, you know, those initial policies, and you're right, Laura, I mean, this is going to go on, well, I was almost said forever, but it's going to go on for a long time of, geez, you know, this just happened, we never even thought of it. But we need that initial set. So do we think that, first of all, who would drive that? Is it our nursing staff? And when do we think we could get the version that we could take forward to the health department and legal to say, is everything cool here? Do you see anything that we could do better? You know, and these are like major points, like instead of 24, you should just say 48 and be done with it.
So right now, everything's done in partnership with the DOH. So if we have a situation like that, amongst the first phone calls that we make is the Department of Health, and they provide the guidance for us. And that's what every other school district is going to be doing right now, because it really is a case-by-case basis until up until the point that you can come up with almost a catalog of all the possibilities.
Yeah, but I mean, we don't say we want to get every possibility, you know, when in case of a bus accident, we don't sit down and say, well, we can't write a procedure or a process or whatever. We can't do our policies until we have every possible scenario documented. We need a set of here's what we do in these cases. And you know, it's obvious, the folks, the nurses on the phone, and I really do appreciate you guys joining us, because I mean, this has been an eye-opening discussion from all aspects, from DOH and as well as from you know, our own staff. But you know, I think even if they document the scenarios that we sort of just talked our way through, even if we know exactly what to do, not everybody's going to know exactly what to do, and we also want to make sure we can take that and turn it into something we can provide to parents. You know, if you come in and you've been out of state, but you write on that form, no, I haven't, and somehow that comes out, you know, what's the deal? So I think there's, you know, if we put some date on getting this first set, something that makes sense to the nurses at all four buildings, that this is something they could sort of operate to, and then you know, and that way we can teach, you know, the teachers what are the right protocols for having someone get sick, having someone, you know, running a fever, all those things.
Now, I have to say, the way that
I lost you, John.
oh, beans.
John,
We've missed you.
You're yes. Back. How about now?
Yeah.
there you go.
Oh. I have to say, sort of the way we did the opening, where somebody took a lead with providing a template and districts modified it to their needs, and FAQs are going to be all the same for all districts. And I can't believe every district's got to draw up their own unique one.
You're right, John.
You're frozen, John.
I'll fix it.
Well, it appears you have the foundation of the flow chart, so it's just a matter of building off of those, I think. I mean, the flow chart says kind of what Perry's saying, but then you can have a secondary page as far as what we discussed, as far as out of state, as far as, you know, basic parameters, and then we can date that and then move forward, and we can kind of update it as we go, but at least you have a foundation of it.
Yeah, I feel like the reentry plan is that foundation, and then we're using those flow charts to build it out. And you're absolutely right, John. There are other districts that are working off of Department of Health templates from Dutchess County and other counties as well. So we are not reinventing the wheel. We're just making sure that we're using information to inform and guide if something happens, when something happens.
Do we know how large the quarantine room will be? I know, and I think they had said they're still deciding on a couple. I don't know if it was Alden or Elm of where it's going to be, but I'm just curious as far as how many students at once you're going to be putting in the quarantine room. Hopefully it's one and done and no more than that. But I'm just curious, is it a regular sized classroom? Is it a smaller room? You know, do you really want to have 3 kids in there where one might be infected and the other 2 aren't? I was just curious if that's been thought through or not.
So Mike had finished up conversations with the principals today, I believe. So I'm sure he's got some info.
Yes, yesterday. We had a
Yesterday.
meeting.
Thanks.
I had a meeting and I met with the principals, and we picked a room in each building. We picked a room that was easy to get out of the building without walking through the building to get to the quarantine room. If somebody was coming in and they show a fever, they would go right into the quarantine room. We picked a room in each building. Some are bigger than others. What's going to happen is the room will be emptied out. The room will have 2 negative air machine scrubbers. One will be piped out the window for negative air, and the other will be outside the door with a HEPA filter to keep the room doesn't feed into the hallway like all the other classrooms to return. So the quarantine rooms will be negative air. We picked a room in each building. The room will be emptied and the room will have marks on the floor. The room's only going to have chairs in it. And the floor will be marked where the chairs go. This way everybody will be distant apart. And we just decided this yesterday. And today my guys were putting up the hand sanitizers, and we did all the windows at Alden that we talked about the other night. So we didn't get to mark out the rooms and empty the rooms yet. I know which rooms they are, and we're going to start doing that probably on Tuesday or maybe tomorrow afternoon when we're done. And the rooms will be ready, by the end of next week.
Great.
Thank you.
Okay, so each reopening plan has written protocol to clean and disinfect schools following the CDC guidance. Each reopening plan has a written plan for school run before and after care programs, and that doesn't apply to us. Each reopening plan designates a COVID-19 safety coordinator who's an administrator whose responsibilities include continuous compliance with all the aspects of the school's reopening plan, as well as any phased-in reopening activities necessary to allow for operational issues to be resolved before activities return to a normal or new normal levels. And the board has appointed Laura, our superintendent of the schools, as the COVID-19 safety coordinator. Each reopening plan has a written protocol to conduct required school safety drills with modifications, ensuring social distancing between persons, and even the safety drills, that's changing. We now have to have, Laura, I think, keep me honest here, it was a total of 24 drills, I believe. And then they specified how many drills of each we needed to have, as opposed to the typical 12. And there was some acknowledgement that if we have different cohorts, we have to have those cohorts engaging in 12 discrete drills.
Correct.
Did I miss anything, Caroline?
No, it's just that there's some modifications that have to be made because of social distancing, except for in the case of an actual emergency, then you're going to prioritize imminent danger over the risk of viral spread.
Yeah, I was going to ask if somehow we're going to explain it to the kids that, in the event of a fire, you don't have to leave single file 6 feet apart. That during a drill you do, but that'll be a little difficult to explain.
Right.
Yeah.
Yep. They don't know the difference a lot of times.
Right. Right. Each reopening plan has a written protocol to conduct, oh, we did the safety drills. I thought that was another one. Each reopening plan has written protocol detailing how the school, district and school will provide accommodations to all students and staff who are at high risk or live with a person at high risk.
So is that that's our remote plan?
That's for staff, there are certain things that they can request, such as a 504 accommodation. There are families, if there is a student with underlying health issues or a parent at home, that's also a 504 accommodation. So there are processes and procedures to support families and students and staff. There's also FFCRA and FMLA, depending on what they're struggling with at home for staff.
Okay.
Each reopening plan has a written protocol requiring all employees, adult visitors, and students to wear a cloth face covering whenever social distancing cannot be maintained. Each reopening plan has a plan for obtaining and maintaining adequate supplies of cloth face coverings for students, staff who forget their masks, and PPE for use by all school health professionals. So Mike Ragusa has spoken several times at this point about all the PPE that we currently have, and we will continue to reevaluate that and purchase more as needed.
Brian, importantly, the words cloth face mask keep coming up in these guidelines. And there are some people who erroneously think that the 3-ply blue surgical style mask is not a cloth mask. Some people are calling that a paper mask. In fact, having been intricately involved in this, both the outer and inner layer of the adult and pediatric masks are a non-woven fabric. So they do qualify under the cloth. There's no obligation that you have to actually produce like a cotton mask or something like that. I wanted to make that clear.
Thank you.
Just curiosity. I mean, kid comes in with a bandana over his mouth, or, kid comes in like with a torn t-shirt over his mouth. Do we have a set of standards that we can basically tell a student that's not acceptable? I'm sure we have one for what's on the mask, but I'll call it the quality of the mask or type of mask. Do we have something that allows us to, basically take that or do something with it and give them a real mask?
That was my question, Perry, because in the guidelines, it includes bandanas, but I've been hearing different things about certain kinds of face coverings. So I'm maybe John Evans or Andrew or Judith can help us guide our thinking, as well as inform parents about what is the best protection for all of us, mask wise.
I mean,
I'm happy to weigh in if you want me to. There are several types of masks. The opinion of my firm, based on the AIHA, which is the American Industrial Hygiene Association, is that any barrier between your nose and mouth and those around you is better than nothing. There recently, within the last 10 or 15 days, was an article that came out that was actually published on a lot of conservative blogs that indicated that wearing one of the gator style, like basically sock over your face was worse than wearing nothing. And subsequent to that, it was sort of disclosed that may have been put forth by a lobbying group that was in the business of selling face masks. So I don't subscribe to that. The opinion that we have is all about protection factor. I would love to see every kid and every administrator and teacher in the school, at minimum, wearing a surgical style mask, even if it's not a technically surgical mask, something involving melt blown fabric. The industry standard that most of the highest risk people that are up in the age bracket are requiring is the N95. The N95 is cost prohibitive at current market rates for everybody to wear and for the district to require everybody to wear it. Our opinion is that at minimum, it should be a fixed face mask style. That includes a gaiter. That, in my opinion, does not include a kid with a bandana around the front of his face. It needs to be something that is fixed, like around his entire face or behind the ears or something. It can't be something where we're just tying a piece of cloth around our face. I don't think that follows the intention of the guideline.
Well, and that's where I think we were getting to is, just because the guideline says cloth mask, that's sort of the minimum requirement.
Yes.
Well, we don't need to be minimum requirement. We don't, we want to be the requirement that, and I realize it's never going to be 100%, but a kid with a torn up bandana over his mouth is not even over his nose. That is not the standard that I think we want to set.
Yep.
So I think we need to again, these are policies that need to be put in place so that parents understand. Again, if your son or daughter shows up with a sock over their face,
right,
they're going home. And that's where these policies, we need a complete COVID, and I hate to use because it brings in so much other stuff, but a complete COVID policy for handling. And as you guys said, it's not something we're going to be 100% day one, but we need to have something in place so that we're not just sort of winging it. And we're not just doing the minimum because that's what we've been told is okay.
There's another district that is calling the person you are describing the mask czar. Your mask doesn't comply. Why doesn't my mask comply? Because I say it doesn't. Put on this disposable mask, come back with a better mask tomorrow. Have a nice day. Like that kind of rule.
So can I ask a question?
Sure.
Can we require a 3-layer mask? Because the mask, the permanent mask, the reusable masks I bought for the teachers are all 3-layer, and the surgical masks are all 3-layer. So can we require a 3-layer mask? And then that would take care of the t-shirts and the bandanas.
Kind of hard to determine in some cases, isn't it? Whether it's 2 or 3. It's a fine line.
Multi-layer mask is
I
fine.
agree with you, but
I think Ragoose is right on point.
I think it would be harder to determine, but it really wouldn't matter because you'd still be getting rid of the single layer.
He's right. Multiple layer mask, period.
Right.
So yeah, even a multiple layer mask.
Yep.
So listen, I'm not by any means trying to throw a hitch in the plan, but having spent a lot of time with high schoolers myself, is a bandana folded over, triangularly tied and affixed around the back of your head, a multiple layer mask. Just saying, there's a teenager out there who's gonna question that.
A bandana like that, when you cough, it goes like that.
Okay, I like that, Mr. Ragusa. Good point.
Because it's only tied around the top. It doesn't have anything from the bottom.
No blowing in the wind. I like it.
Like that, and when you cough, it goes like that.
But this is where we should write it up the way we think it'll do it. See if it legally we have the right to, go over and pull on the bottom of the mask to see if it flips up, and talk to the Department of Health and say, does this describe a real mask, not a, here's the minimum requirement given a cloth face or a cloth covering. This is what we're saying that our students have to wear. Does it meet, not just minimum requirements, but, is about the best we can do.
And also ask legal if you can put on there that we, as the staff, reserve the right to replace a mask if we don't deem it fit, something like that after the guidelines.
Yeah, that's what I mean. I think, and that's what I was talking about before, of getting all these policies in one place so that we can take a bunch of scenarios and go, did that work? Did that work? Did that work? And at least we have an initial set. And if the Department of Health or state education has published something that we can start with, great. But I think we need to do more than just say we're meeting minimum health department requirements, or, you know, because there's going to be things like this that, you know, putting holding their hat over their face or their mouth. Hey, I got cloth, you know. So anyway, I think we
Even the
beat that
simple
one to
thing,
death, but
one last point, even the simple thing, are you going to allow ventilators on the masks? Because a lot of people do not allow that anymore. So that's something simple that you can put in there as a mask without ventilators, you know, because that filter's coming in but not going out in most cases.
okay.
It's interchangeably described as a valve, a non-valved mask. None of the masks that reasonable school districts are using have a valve. Valves are bad.
Okay, we're really at 8:30, but
Harry, can I get clarification on something that's on the screen right now? It says
I'm
each
not-
reopening
myself.
plan has a written protocol detailing how the district school provide accommodations to all students and staff who are at high risk or live with a person at high risk. Who do these people report to? I think we need to clarify at the school who these people report to.
Do you, can you clarify, Claudia?
Well, just know, I mean, if there's a teacher at high risk, who are they going to report to? Who is the person that they're going to report to, or who is like a student? If they, you know, if the parent has to call, who are they going to go and speak to?
So if there is a staff member who's seeking accommodation, that goes through Brian or myself, and there's a procedure that we've been working with our attorneys. So if they're seeking a 504 because of a certain health issue, they have their doctor fill out what they're struggling with, and then our district doctor has, in collaboration, decides what the appropriate accommodation is. It could be working remotely. It could be working in a separate space. It could mean that we need a different kind of PPE for that person. So there could be various accommodations. It doesn't necessarily automatically result in remote work.
Okay.
And then if there's a student, then that would go through the PPS office. That would be Caroline, and that's also a 504 accommodation, and working with that family, their physician, and Caroline's team.
Well, wouldn't they both report to? I guess I'm confused. Is like Brian's part of the finance department. Why wouldn't they report to Caroline? Since Caroline works with the teachers and she's curriculum, why would they not be reporting to Caroline? And
well, we're
talking
about attendance, leaves. If there are, say for instance, there are staff members who are requesting to work remotely because they have somebody who has in their family or in the household, or they're a caregiver for somebody who has underlying health issues. We're talking about leaves and FMLA and FFCRA, and I feel that works nicely with the business office and attendance and working with legal. And Brian, please chime in with that collaboration between you and me, and then that families and students are going through the PPS. It actually
Laura, do you mind? I'm sorry. Do you mind if I jump in on that one?
Sure.
So Claudia, if anybody who's requesting a leave of any kind, it would come actually to me first, and then in normal circumstances, and then it goes over to the business office. So this is normal protocol as far as it coming into superintendent and business office for our staff.
But it doesn't necessarily have to be a leave. I mean, if someone says, my job is to, I got to load them and unload them on the buses, and I feel exposed, and I'm making this up, but, is there a room that I can do my job out of where I don't have contact with the kids? Is there a backup for another position that doesn't have to interact with possibly contagious children, like dealing with, I can see the quarantine room and the nurse's office and the office getting pretty strung out with kids at any given time. and having, now we got to keep those kids apart. I would assume we got to call their parents, get somebody in because, they got a stomach ache, go get, do all the whatever we got to do to tell them what they have to do to get back in school. I don't think you can ask one nurse to do that. So how do we, if the other people that we're talking, whether it's office personnel or whatever, if we're saying to them, hey, you got to watch the kids in the quarantine room, or you got to sit in the nurse's office and deal with the kids that are that fell down and scraped their leg. How do we, some of this may not just be people that want to work from home.
Right, and so even in a normal circumstance, an employee, if they needed any type of a work accommodation, and that can happen at any time, they would first reach out to their supervisor, their immediate supervisor, but then that would have to come into the superintendent's office, because most of those, if they're requesting it and need it, like, we would have to review it with legal and make sure that we're doing it the right way. And then that too could still require more things. So, and Laura would be able to speak to that more, but it would still come through our office to make sure that it's being handled properly. It's essentially the HR portion of our office.
Okay, I'm glad you brought that. I was just going to ask you about HR, because we, where I work, we have HR department. So who's our compliance officers here? Who are the compliance officers at the Millbrook Central School District?
So we don't have an HR department here, Claudia. And a lot of other school districts, larger school districts, will have a separate, maybe an assistant super or director of HR. The HR function is covered by the superintendent's office and the business office. So as an example, out of the business office, we work with onboarding, we work with group benefits administration, we work with workers' comp, we work with health insurance, all of those HR functions. And then out of Laura's office, as an example, there'll be issues with civil service that comes out of there. And Cheryl is the contact for civil service. Out of Laura's office also, and Caroline assists with this a little bit too, with regard to credit bearing courses and how that applies to salary. And then of course that comes back here with regard to payroll. So HR, the whole HR function is really split in a small district like ours. And traditionally it's between the business office and the superintendent's office.
Right, so one last question for you guys, and this is really for the nurses that are on the phone. Do you guys feel that you are that you have the staff you need to deal with, when we eventually go back to, some form of in class? Do you guys have the resources you need to cover the 4 schools and deal with not just the, kind of your current, or maybe it's not your current, your previous responsibilities, and then, add on the contact tracing and the interfacing with the health department and all the training that you're going to have to do for our staff? Do you feel comfortable? Are you nervous about that? Like, it's just, I don't know how we're going to do this with however many people.
I'm going to speak first, I guess. I'm Maureen again, not Julie. I guess what I would say is, personally, I'm a newer nurse to the district. And I will say that the 5 nurses, the 5 of us that we work with, I shared this with administration today. I think that each of the players on this nursing team bring different nursing experiences to the table. And I think obviously that's beneficial. I know we're spending a lot of time together all next week during those professional development days, getting all on the same page. And I do think we work collaboratively together. I guess my short answer would be, I don't think we really know what we're dealing with. So I can't really say if I feel like I could use more help or not. I feel like we can get as prepared as we could possibly be. And I think not to overuse the word, but I think it's going to be somewhat fluid because the schools aren't opening right away. I think that'll give us an opportunity to kind of figure things out. As more data comes in really from other districts that open sooner, we just have to keep watching the data and doing the best we can with what we have. I don't want to speak for anybody else. With the other nurses, by all means, chime in. But I feel like that's like a hard question to answer because we're all nurses. We've all worked in isolation before. All of us. We've all donned PPE. We've been in with with infectious diseases. Like, it's just part of our training, so it's new to the learning environment, but it's not new to us as nurses. So there are certain things that I do feel we're very comfortable with, but other than that, I mean, to be continued, I guess.
Maureen, did you say 5 nurses?
Yes, right? Yeah, the four nurses at Elm, Alden, Millbrook Middle, Millbrook High School, and at the public schools that are located within the geographical area.
The person we send to the private schools.
Yes. Yeah.
So really,
Which is Maureen.
so we have
And one is on leave. I mean, I don't want to be telling deaths.
yeah, no.
That's why the 4 or 5 thing right now, we have 4 or 5 nurses.
So basically you guys are solid, you need nothing, and
Basically, we're very effective. We're going to work really hard. And if we need anything, we'll let you know.
write that down. Write that down, Brian.
But I don't want to speak to.
No. I know I'm putting you guys on the spot. I really, just like we told Mike R, if you need something, ask, because this is uncharted territory. We don't know what's going to happen. We don't want to overreact, and have bring an entire hospital's worth of nurses into Millbrook, but we also don't want to underreact. We don't want to have one nurse running from to 5 different places. So somewhere in the either what we have is okay, or we need help, or whatever. And same with equipment too. I mean, if there's something you need, Mike can usually get it off the back of a truck, but but you got to let us know. Okay.
Absolutely. Thank you.
All right.
Can I add to that? So, can I hear me?
Yep.
Yes.
Okay.
Are you listening?
So, no. So I had a meeting with the nurses today, and I learned a lot. And also, we talked about, like you're saying, where they need a hand. So they'll need somebody to watch the kids in the quarantine rooms. So I already talked to air guys about fit testing about 12 people, because we have to, anybody who goes in the quarantine room would have to wear an N95 mask. So I already have that kind of set up. I have to talk to the principals to see who, we would need 2 more people in each building in case we would need 1 more person in each building, but then another one in case that person was out for any reason. So we want to fit at least 2 more people in each building, and then anybody else who wants to wear an N95 mask. So far I have about 12 people, and I talked to air guys today about that. And as soon as I get a list together of all the names, we're going to get that done. This way they'll have a little bit of extra help if they need it. I mean, I don't know if that's what you're talking about, but at least they don't have to be in 2 places at one time.
Yeah, I mean, I worry about the teachers with substitutes. I mean, we could drop teachers like, a bunch of them at a clip, and to have teachers that are trained on all the stuff that we're talking about here, all the processes. Same thing with the nurse. I mean, God forbid, but a nurse goes down with even a common flu, and we're down one, and now, the whole time are we slightly at risk? Are we at risk? So, and same with equipment. I mean, I don't know what kind of equipment you have in the school, but if there's something that can keep you guys safer, we should be looking at those things. All right. Did we get any questions? I only see one.
I sent you a question 15 minutes ago, Perry, privately. So on item 2 there, I just want to understand, this is standard phrasing, but my understanding is that's not what we're doing with in-school lectures of the hybrid plan, right? Students will be wearing all masks full-time unless there's a mask break. Is that correct?
Correct.
Yes.
Because this statement doesn't say anything about that. And I didn't see that at all in our formal reopening plan we sent that to Albany.
Yeah, I think the reopening plan the original reopening plan was updated to say that they wear them, at all times, basically, unless they're given a mask break.
The word mask break is not used anywhere.
Yeah.
So we need to clarify this kind of stuff.
Yeah.
We need to clarify where we diverge from this statement, this second statement, and people have to be able to understand where it's not as relaxed. It's more tight or conservative. So thank you.
Yes, absolutely. And this is the NICED wording. And then in our parent meetings, we spoke about mask breaks. And this is in conversation with our union as well as how do we want to conduct our classrooms. And so that was sent out too. So now we have to put it, you're absolutely right, now it has to be reflected in our reentry plan so that it's all very much aligned and there's no room for misinterpretation or confusion.
Thank you.
Yeah, thank you.
And we should probably also clarify about the cloth face covering. If we're not allowing handkerchiefs, be as specific as possible.
Yeah, we'll do that, reflect that also in our reentry and then also in our communications with parents too. So everybody's on the same page. And with our training with staff.
Thank you.
Okay, so Perry, just some guidance from you. We're about, 17 minutes over. Would you like to, for us to continue and finish this out, or did you want to stop here? What would you like?
How much more do we have to go?
Let's see, we have these 4 bullets, another 2, 8. Yeah, we have a little bit.
Okay, so I think we did 45 minutes per bullet. So if I,
and the thing is, we covered a lot of ground, so maybe we,
let's try to finish it up.
Okay.
I don't want to go past 9 if we can.
Each reopening plan has a written protocol to instruct parents and guardians to observe signs of illness in their child that require staying home from school. And we've spoken about that already, and that we're going to really require and need parental assistance. I'll share with you, the question did come up at one point, well, what are you able to do for our kid, if all temperatures are going to be taken up front at the door? So some of that's going to be private. Our kid's going to be taken out of a line. And the answer to that is yes. And that's why we really need the help of the parents to be able to take their temperatures at home, to not put us in that predicament, because we're not going to be in a situation where we can't remove a child from a line, because we wouldn't be able to allow that person to go into the building and potentially harm others. So we really need the help from the parents in that regard. Each reopening plan has a written protocol and appropriate signage to instruct staff and students in correct hand washing, hand and respiratory hygiene. And that is true, and they'll be training about that. Each reopening plan has a written protocol to ensure all persons in the school building keep a social distance of at least 6 feet whenever possible. And that's also true. Each reopening plan has a written protocol to address visitors, guests, contractors, and vendors to the school, which includes the health screening. So anybody who enters the building would be required to have their temperature taken and include the health screening.
So who makes who sets the whenever possible phrase? I mean, can we just say, well, it's impossible for us to load all the buses with all the kids staying 6 feet apart, so we're just going to go to 2 feet apart. They got masks on, don't worry about it. Whenever there's a phrase like whenever possible,
Yeah.
it just leads to we need our version of this. What is our acceptable reasoning behind, like I think this afternoon I was talking about the elevators in this, and not the elevators, but those lifts in the stairway. Do we make all the traffic go one way then the other, or do we, you know what I mean? So is that one of those situations that's a whenever possible or whenever not possible?
Yeah, that's exactly the work that happened. Yeah. So all of our hallways are lined, and they're going to be arrows and one-way directionals and every bit of what you just said. So for the most part, it's 6 feet and a mask always. It's always going to be a mask unless it's a silent mask break. And then the wherever possible, the rule of thumb is going to be 6 feet. Absolutely. And then it's going to be, I'm trying to think of situations where we might not be able to manage 6 feet.
We talked about when not possible before, right? Like we talked about in the case of an emergency. We talked about when, there may be like a student injury and the nurse is not going to be able to be 6 feet apart because they're treating a student. So we talked about some of those cases where 6 feet is not going to be possible because it may be necessary to be within that 6 foot radius of that student. But in that case, when it's not an emergency situation and we have the availability of, if necessary, taking other precautions, we're going to do that. But if it's an emergency situation and there's an imminent reason to be within that less than 6 foot distance, we're going to do that for the imminent reason.
Right. So and that's my point, Caroline. We should have our policy which says unless there is an emergency situation, it's 6 feet. And then we should also have, sort of an add-on to that is, the first time kids are not 6 feet apart, what do we do? We can't have people going around, hey, no, we can't do that constantly. So, and I don't even know if it's there anymore, that, that elevator in the middle school that goes between floors, and it used to at least take up half of the stairwell, sort of. I mean, does that mean that, 3 kids come down, 3 kids go up because the stairway is not wide enough? Or is that one of our, that's where we just, like I said, we need to get the Millbrook version of this thing.
I also wonder, and I don't know if Andrew or Judith can chime in about this, but I always thought it was, if you're wearing a mask, you could be closer to people within 6 feet. But now I'm hearing like you have to be 6 feet and wearing a mask. And so I'm confused about that protocol, because I know it started out as you're wearing a mask or you have 6 feet. But now I'm hearing wearing a mask and 6 feet. And so is that what the Department of Health is suggesting or recommending or requiring?
Well, the problem is that, the mask is not 100%. I heard you guys talking about types of masks before, and like part of it is like not just the material, it's the fact that some of them fit better, seal better, you can't move them around. Like the gaiters, it's easy to pull this down and not have it be effective anymore. So, but yeah, the optimum is but there may be places where you can't. So you do, again, like I said, none of this is 100%. That's why I think you even have the whenever possible. I agree with you. You got to maybe tease that out a little more, like more likely for an emergency situation. But again, none of this is 100%. You're doing the best to contain. The colleges, we've already had them open, and we went through some of this. What you're going through now, it's very similar to what the colleges are going through, you know, they tried to have as much contingency in the initial plan, but it evolves when things start to happen, and then you meet those on and maybe adjust your plan as needed. But you know, they've been able to they have had positives at the colleges, and they've been able to with their plan keep it so that they can remain open. That's your goal mostly here, is to remain functioning and open. So you know, and like I said, I cannot guarantee you will not have a case of COVID at your school. So I don't know if that helps.
No, I think, I mean, our stuff should be updated to say, you know, mask and 6 feet, and then, you know, unless in an emergency, you know, and you can sort of define the emergency levels. But I mean, I think, you know, our number one goal is really to try to keep these kids as healthy as possible, and then of course keep them in school. But you know, the first thing is to do our best, and sort of not just minimum, to make sure they stay healthy. Okay.
Each reopening plan requires that ill students and staff be assessed by the school nurse or medical director, and that if a school nurse or medical director is not available, ill students and staff will be sent home for follow-up with a healthcare provider. Each reopening plan has a written protocol requiring students or staff with a temperature, signs of illness, and/or a positive response to the questionnaire to be sent directly to a dedicated isolation area where students are supervised prior to being picked up or otherwise sent home. So the key there is that it's a supervision function there at that point. It could be any staff member that's able to be in a position of supervising kids. So that could be an aide or a monitor that's going to be in that room, because aides and monitors supervise children by job function. That would be for the isolation portion of the room.
I assume the same goes for teachers that go sort of room to room. You know, if they're, for whatever reason, you know, they're not set in one classroom, they're going from place to place, then I assume the contact tracing, if that person was to get it or be exposed to it, that would extend out to every classroom they've been in.
Yes.
Okay.
Not exposed, however. Being exposed to someone who has symptoms or disease, has symptoms, doesn't mean that they can't. It's when they have disease.
Right, good point.
Then it matters.
Each reopening plan has a written protocol developed in collaboration with the district or school's director of health services to instruct staff to observe signs of illness in students and staff, and requires symptomatic persons to be sent to the school nurse or other designated personnel. Each reopening plan has a written protocol for daily temperature screenings of all students and staff, along with a daily screening questionnaire for faculty and staff, and periodic use of the questionnaire for students. So that is absolutely true. And we've signed on to a software called Eduware. And what that is going to do is it's actually an app where people are going to have the opportunity to sign in on that on a daily basis. And we're going to be able to make sure that everybody who's signed in and then and use that. We've decided different districts are doing different things. We've had conversations in our district about defining periodic use as or periodic use of the questionnaire for students as daily. That it was that important to make sure that we had a daily questionnaire to make sure that we're able to keep abreast of any issues as quickly as possible, and not leaving it to chance where it may be a week or every 2-week period. It's going to be a daily questionnaire for students as well. Each reopening plan must engage with school stakeholders and community members. And I won't get into the parenthetical piece of that, in developing the reopening plan and identify those that participated in the reopening plan. And our membership is listed in our reopening plan, and there were many stakeholders that were represented. And that was our subcommittee structure that worked to assist in this as well. Each reopening plan must include a communications plan for students, parents, guardians, staff, and visitors that includes applicable instructions, training, signage, and a consistent means to provide individuals with information. So we are working on that as well. You'll note that we have a separate reentry tab on our section of our website that's updated regularly, that is linked to all sorts of information. And actually, I know, Laura, you were going to talk about this if you didn't already, but all our FAQ is posted as well. And we will continue to, and that's from the parent sessions, and we'll continue to add questions as we get into times that get closer to hybrid. And we'll just continue to add the questions that come in.
Brian, sorry, can you say that again about the question and answers? Where are the questions and answers posted?
Yep, they're right on our, so if you go to our homepage, and I'm going to do it right now just so I can see it as I'm talking about it. There is a box that's right under announcements that says Millbrook CSD 2020 school opening, frequently asked questions.
Brian?
Yes.
Just to clarify though, the questions and answers from these sessions, these are formal board meetings, and our policy for board meetings is that when there's a Q&A time during a board meeting, we answer the question, assuming it's a question that's related to the agenda. We answer the question to the person or persons answering it or asking it at that meeting. We realize that these are really weird times, and that, you know, we don't expect parents that all want to know the answer to a question to ask the question separately. Our legal team has told us that basically we can, because of, you know, this strange time, we can put the questions and our answers, even though they were questions that were asked by a specific person during the meeting, we can answer those. And basically it'll be a disclaimer that we're doing it this way because of COVID. But those questions, I don't believe, Cheryl, unless you got them out in the last hour or two, I don't believe those are online yet, because we didn't know if we could even put them online.
Right, that's right.
Does that make sense, Claudia?
The parent meeting ones, that's the ones I'm talking about, the three sessions we had. Those are the ones that are online?
Yep, or they're supposed to be, yep.
So let me, I forgot that I can share it, so why don't I? So can you see my screen?
Yep.
Okay, so here's our homepage. Here's the box, and click on it. And here are our frequently asked questions. And like I said, so we've updated it as late as today. And we will continue to update them as those questions come in, and as they, and of course we're doing it in priority order as it pertains to what we're doing, and you know, they might be more timely than others, and we're just getting them up as quickly as we can. So we have a good 7 pages or so of questions that have been answered. So we definitely invite you to go ahead and take a look, and it's right there.
I'm glad you're there, Brian, on that page, because I've also, as I'm looking through this, I see that on Elm Drive, the principal had written a welcome letter and welcoming the kids back to school and the supply list, but I do not see anything for Alden Middle School or the high school or anything like that. So when do we plan on getting that? And I guess, Laura, you can answer that one.
Well, they were working, I'm thinking that it's either this evening or tomorrow they'll be sending things out. They were working on them as a team just yesterday.
Did a parent communication go out that it's on the website for Elm?
Doesn't look that way.
Tom, how did you left it with your colleagues?
Yeah, so Elm Drive's parent communication went out only online. It's being sent out tomorrow, along with the rest of us. Mike did, I I believe he also put his supply sheet on there as well.
Yes, what's on there right now is the update for the it says supply list and a welcome letter from Mike. This is exactly what it is.
So all the stuff will be out tomorrow, Tom? Is that the idea?
I believe so. They're all ready to go with just a couple things to add to them.
So Steve's will be out and Rick's will be out and yours will be out tomorrow.
Yeah, and also Mike is sending some more things tomorrow as well.
Okay.
And
There's going to be an email
Okay.
announcing to look at the website.
I'm sorry, I didn't catch it.
I'm sorry, is there going to be an
she's
email?
asking the same question
Oh,
I am.
go ahead,
Oh
Jen.
no, it's a hard copy mail.
Is there going to be an email sent to take a look at your mailbox to say that there's going to be something coming in the mail? And is this going to include also the curriculum, the teacher, the student schedule and the assignments, you know, who the kids are going to get and, you know, what their schedule looks like as well? I mean, can we have a communication to the parents tomorrow? Is that what you're saying is going to happen tomorrow?
I believe so, yes.
Caroline, if you're shaking your head. Yeah.
Yes, all of that will be communicated tomorrow.
Okay, great.
And that's a physical mailing, you said, not an email?
Well, the middle school and high school will be an email for the you know, classes and so on. Alden and Elm put out their placement on as a actual letter that'll go home in the mail, the regular mail.
Yeah, there's two pieces to it. The schedule will be posted via the parent portal. Any parents that request a paper mailing will get a paper mailing at the secondary schools. But there will also be a physical mailing for all of the households that will have the annual mailings that come out from the district, from the superintendent's office, as well as the secondary schools, and that will be coming from all of the buildings.
So Caroline, just to clarify, there's going to be one big email that's going to go out to the entire district that's going to say, take a look in your mail that you're going to get something, or is it just going to be on email? Can you just like really put it down in layman's terms?
So I don't know about an email. The parent portal is where the schedules will be. There will be a physical paper mailing that will have the information that is the annual mailing that comes out from the district, and that will include paper mailing for families that request paper mailing. So that will include schedules for those families that include paper mailing. Otherwise, schedules will be available on parent portal. The paper mailing from the district and the buildings will go out as it typically does annually. Otherwise, the elementary schools will have the paper mailings for class notifications as well as schedule, etc. And that's in addition to the typical annual mailings that go out as normal. Did that cover all of the pieces?
I think so.
Yeah,
And
there's lots of different pieces.
And the parent portal is really for grades, if I can remember, it's really 6 through 12, right?
It's mostly utilized in the secondary schools.
Okay.
All right. Any last minute comments, Laura?
No, I just want to say thank you to all of our panelists, Department of Health, our industrial hygienists, John Evans, our school nurses, assistant superintendents for hosting these work sessions. I think they're super important. Again, I'm always a big believer in we're stronger together. So this was a good session. We have, we learned a lot. We have a lot to do. We've accomplished a lot. So I think we're in a good place.
And yeah, I just wanted to take a chance, or a second to say, sorry. I know I promised you guys it would be over at 8:30, but I couldn't help myself. So anyway, thank you, everybody. See you again on Tuesday.
Yep. Have a great night. Thank you, everybody.
Stay safe. Be well.
Thanks.
Good night, everybody.
Night.
Take care.
Good night, everyone.